Angiotensin II enhances vasopressors in the treatment of vasodilatory shock. Vasodilatory shock causes peripheral vasodilatations and lowered blood pressure. Vasopressors are used to restore the arterial pressure. In contrast, patients with severe vasodilatory shock have shown slow prognosis. In this study, the effects of angiotensin II in treating vasodilatory shock were evaluated. The objective of the study was to evaluate the effects of angiotensin II on vasopressors in the treatment of vasodilatory shock. The study was an international, randomized, double-blind, placebo-controlled study of sample size 321. The inclusion criteria in the study was patients who had history of vasodilatory shock and crossed age of 18. The exclusion criteria of the study was patients with more than 20% of burns and who were on treatment with high dose of glucocorticoids. Patients who had vasodilatory shock were randomly divided into two groups. Angiotensin II group, the group had 163 patients, and placebo group, the group had 158 patients. Baseline mean arterial pressure was measured randomly before the treatment. Adjustments of angiotensin and placebo were made according to the body weight. During the alterations, vasopressors were kept constant. The efficacy outcomes of both the groups were evaluated, and high numbers of patients in angiotensin II group has met primary endpoint criteria than the placebo group. Adverse events in angiotensin II group were less than placebo group. Cardiac disorders and respiratory failures were also less in angiotensin II group when compared to placebo group. The study concluded that angiotensin II increased blood pressure, improved the effects of vasopressors, and made them potent for the treatment of vasodilatory shock.